Holly Cotton here, and you guys know that one of my missions in life, I have several, but the one of them is to educate, spread knowledge and awareness, especially when we're talking about minority health. Me as a nurse, all of these platforms that I go on where I'm talking about health and wellness, I love whenever I interact with people some kind of way, whether it be through the algorithm on social media or at an event. And I love when I hear people that are doing things, especially for minority women. So I am so excited to talk to this specialist today. I'll just give you a little hint. He is known as the Fibroid Slayer. So I have Dr. Pierre Johnson, who is a minimally invasive gynecological
It, it fast. A lot.
gynecological surgeon, and he's going to tell us all about what he's doing, how he started, and of course how he is a gynecologist and what he's doing right now with all of that specifically for fibroids, and he's going to educate us on some of that as well. So Dr. Pierre Johnson is also called Dr. P on social media. So welcome, Dr. P.
Thank you. Thank you for having me. I appreciate it, Holly. Pleasure.
Yes. Okay. So first of all, it's kind of hard. I know a lot of people when if they're not in the medical field, they are always curious like how did you choose that or why are you doing that? And there are certain things there are certain genres of wellness where people think are a man's field or a woman's field. And I know gynecology is one of those where even though there's tons of male doctors, a lot of people always wonder like, and also it's hard to have a partner as well, because some people might be like, well, I don't want to date someone or I don't want to marry someone that's looking between people's legs all day, or it's sometimes it can be that way. But when you're in wellness, people don't understand. You don't see it as like a sexual act. If I'm catheterizing a man or I'm doing something, I'm not looking at it as like anything sexy
Yeah,
at all.
yeah.
So, can you tell us how this became like where you wanted to start practicing?
Sure. Yeah, that's a lot to unpack, but I'll start where I started, and then we'll go into my whole focus as far as like my mentality with taking care of women. But for me, like I'm born and raised outside of Chicago. My aunt challenged me very early to choose something else other than play professional sports. As a kid, I wanted to, be a basketball player, baseball player. That was my whole idea of life of playing professional sports. And she told me, look, you have to give me a plan B. And so, a couple weeks later, I just said I wanted to be a doctor. And why I wanted to do that was because there was absolutely nothing positive going on around me. My parents were addicted to drugs. Like I just had chaos all around. But the only positive thing that I saw of success was the Cosby Show. And so the Cosby Show was like it kind of implanted a seed to where I saw like, somebody, a black man just taking care of his family, being very professional. And I really liked that. And that's really how the seed planted. And from there, I really got fascinated. So I was very fascinated with childbirth. That was my big thing as a kid. Like the physiology behind childbirth, everything about it. My mom was pregnant with my first sibling, and when I was 9 years old, I was able to talk to my OBGYN, or her OBGYN at the time was a black man. And that just the whole imprinting and that process just really just kind of just imprinted in my young mind. And from there, it was yeah, I want to deliver kids. I want to deliver kids. I want to have, deliver babies. But, when I was in high school, I started to cut hair. I was a barber. And I just cultivated that skill. And I was just like, hey, I'm really good with my hands a lot too. And so that's when it kind of opened me up to the gynecologic aspect of it, of being a surgeon. And I was like, I can really do something here because I'm very good. I was like cutting everybody's on the blocks hair. And then when I went to college, I put myself through college as a barber, cutting people's hair, 2, 3 o'clock in the morning, cutting hair. Before medical school, I was actually in a barbershop, like cutting hair in a barbershop. So just the skill of and the dexterity and the pinpoint precision that you have to have as a barber, I was just like, I'm really, really good at this. I should be, looking the surgical part of it. And that's how the gynecologic part really um, drew me in, and I was like, I can really do something special with this as an OBGYN, be a specialist at minimally invasive surgery, because it's just not a specialized part of what we do as OBGYNs. And I found a niche to be able to help women, especially Black women, in that regards, just with my skill set. And so for me, it was, going through medical school, reading textbooks about, J. Marion Sims and how gynecology started, and just understanding the brutality that Black women went through throughout centuries to actually get these technological advances in surgery that we have right now. It just really burned my soul that these women were not given, the credit in history, and that we still had uh, gynecologic surgeries being weaponized against Black women even today. So I was reading that, and as I'm looking at the landscape of, of our country and our culture, and just seeing that 2/3 of all hysterectomies are performed in southern states still to this day, and the racism and the implicit bias that is in medicine, it made me want to be a part of the change and be able to do something to impact how Black women are treated in this country. So that's really what sparked me and drove me.
So, how long did you practice so most of the time, just for anyone who doesn't know how that transition is, you decide you're going to go into medicine and then you match with whatever program that you're going to go to. You decide that's the direction that you want to go. Then you start doing your residency and all of this stuff, and then now you're like, "Oh, okay, now at this point I'm going to start practicing at a physician." So, how long did you actually practice as OBGYN until you started where you were like, I'm going to have my own practice. I'm going to start specializing in this. Like, what was that time period
Sure.
from I'm just starting out to now this is where I want to specialize?
Sure. So, it was 4 years of undergrad. Everybody does that. So that was first in Louisiana Xavier University. So then after that, I just wasn't prepared for medical school. I didn't have the MCAT scores. I wasn't, coming from, a place from just not privileged, trying to get through that pre-med curriculum. I got through it, but now it's like, now you have to get the challenge of standardized testing and do well on the MCAT or what have you. So I did a post-bac program just to really get my testing skills up. For everybody who's listening, testing has absolutely nothing to do with intelligence. It has absolutely nothing to do
At all.
with your success rate. Like, I know people that score in the top 5 percentile of MCATs board scores, and I would not trust them with my hamster or anything to let them take care of any part of my being, let alone operate on it. But that's neither here nor there. So after that, I did well on the MCAT, and then went into medical school. So that was another 4 years. So 4 + 4 is 8. After medical school, and I always knew I wanted to be OBGYN from the gate, from that little 6-year-old boy to this man today. I've always wanted to do what I'm doing, which is a rare thing. Most people don't know, but I've been driven as far as exactly what I know what I wanted to do. And so medical school, I did 4 years of that. After medical school, I wasn't, I didn't. There was some issues with like scoring and stuff like that. It's really all a scoring game as far as like your testing scores and sort of how you get into your particular residency. So because you have to go to a residency program for whatever you're specializing in. But it was the best thing that could ever happen to me, because I was able to like scramble. When you don't get into whatever field you want to get into, you have to like do something. I scrambled into a general surgery program, which I could not have changed the script any better for myself. What I thought was a curse at the time was the biggest blessing ever. So I did a year of general surgery, which really, really took a kid that was very good with his hands, with dexterity, took him through a whole year of rigorous training of learning and getting better. And then after that, now I took that into 4 years, another 4 years of residency, of OBGYN residency, learning about OBGYN and the craft or whatever. So 4 + 4 + 5 is 13. And then from there, graduated, finished residency. So 13 years. And then, I came out, I went, fortunately enough, I went to a program for residency that gave me nothing but opportunity to get the skills and the training. It was a program with only a few residents and nothing but a bunch of doctors that had cases, because that's really how you train. You have to have the cases. You have to have the people that actually will allow you to do the cases and get into those cases, because that's a lot of the problems with like OBGYN residencies where they don't have the case volume and they don't have enough
That's okay.
experience. I had an abundance of experience, more than I can even have dreamed of. And then more importantly, I was aggressive. I was extremely aggressive about getting into every single case, staying late, getting in early. When I was able to get on a Da Vinci robot, like my second year of residency, I was there at 3 o'clock in the morning every day trying to get better and better and better. So after that, um, I went and started working as just a general OBGYN, delivering babies, doing surgeries, baby surgeries, doing all those things. Just normally just honing skills, honing skills, honing skills until about maybe about 5 years ago, where I was just like, hey, it's really time to focus in on what my purpose is, and just like really specializing in surgeries that no one else does. And so I really just started to cultivate a skill of handling very tough fibroid cases from a minimally invasive standpoint. And I just had that whole focus of don't turn down any case. There's nothing that I can't do. That every case I'm going to learn from, and then before you know it, it's like I'm building up all of these really, really difficult cases that nobody wanted to do, and utilizing my experiences and skills for those cases. And then it just started to become routine. So the harder it I'd get
Mhm.
through it, and then it really just kind of honed in on my skill level.
I love a couple of things that you said. So one, I think people don't realize also the liability that comes when you're talking about obstetrics, because people forget that you're talking about two people instead of one, compared to whenever you're talking about gynecology, it's usually just the one person and the one parts. But the liability that goes with obstetrics, where now if something happens to your baby, I'm liable to you and your baby. So I know it's very hard to have that in a teaching environment, because I even know whenever we do like OB rotations, like no one will let the nursing students touch anyone. They're like, don't touch, do not do not touch anyone, you're here to observe. And then also, I love that you talked
Thanks.
about how you came from Chicago and then also just having that drive, because I wanted to highlight your story because I love that you are now that Dr. Huxtable for someone else. I want people to be able to see how, this is Black men still doing this. This is a different reintroduction of it. Like, not everyone is going to be the Huxtables. Not everyone is going to have, the man, the doctor with the husband and the office in the basement. That's not a reality situation. But I do love that you do have where you're coming in and you are minority and you are also doing something that is, like you said, the niche. And my next question is about the niche, because I know, first of all, I always have people that come on. I just had a gynecologist. She came on like maybe a couple of months ago. I've had some like sexual health physicians come on. So I always have a lot of physicians on a variety of topics.
Sure.
And whenever we're talking about women's health, because I do have a large population, mostly is women
Yeah.
that listen to my show. And so, one, can you just explain, because we're going to talk about how you're talking about minimally invasive and fibroids. Can you tell us exactly what a fibroid is,
Sure.
how it grows, before we talk about excising it? Like, what is a fibroid?
So a fibroid is an abnormal growth of smooth muscle, right? So anytime you have a place where it's smooth muscle, which your uterus is the biggest organ of smooth muscle that you have, there can be abnormal growth of cells. I look at it like a callus for your uterus, right? Just like you have calluses on your hand where they'll grow after you lift weights or whatever. It's kind of similar. The difference is, and not to minimize it, it's that it's responsive to hormones, and it can be responsive to hormones, meaning that they can grow. They have like they can get big or what have you, as opposed to just being there. But they grow on the uterus, and 99.9% of the time they're completely benign, meaning that you can live with these and they're not going to kill you. They're not a cancerous growth. They're very benign in nature. Very rarely they can be cancerous, but it's a rare thing to happen. And then
So
what was the
why
second
do
part?
they grow so big? Why? So whenever you're okay, so whenever you have a fibroid, it's a growth. So why do some grow
Sure,
so big? And can you do
sure.
something besides hormone to stop it growing? Or is there something that you can do as a woman to stop fibroids from growing? Like what can we do on this part to stop it or alleviate those symptoms?
Awesome. So what we don't know. So there's some things we know and we don't know. What we don't know is why some women have the propensity to grow these things like quickly and rapidly and very big, and why some women, like I have women right now that have had 2 centimeter fibroids for decades. Never grew, never did anything. It just stayed that way. And I can have a woman that that started off with a 2 centimeter fibroid, and over 2, 3, 4 years, it grows to a 20, 30, 40 centimeter fibroid, right? Why that happens, that part we don't know. Why in these particular women's does it have this abnormal growth, and others that it doesn't? We do know that growth is stimulated by estrogen, which is the natural hormone that the ovary is producing, right? So we just don't know that why all women are producing estrogen. Some women will now have these fibroid growths that respond very abnormally to it and get bigger. Other women will have it, they have this estrogen and it doesn't grow at all. what we the things that we know as far as preventative measures, we don't know a ton. What we do know is that there are things that have shown to increase the likelihood of fibroids. Processed foods, meats. We have links to show that there are women with omnivore diets have a higher rate of fibroid growth. However, the misconception is that every vegan vegetarian woman has no fibroids, and that's false, right? So we're looking at one factor, but this is a multifactorial thing, meaning that there are multitudes of things that come into it. What we do know, and what there's some studies at the University of Chicago that are actually ongoing right now, that that there are genes for fibroids, right? So that women have genes that code for fibroid growth, and that some women have these abnormal genes, and you can pick them up, and they're going to have the propensity of getting larger fibroids or big fibroid growth. And so what they're trying to do now is to create a almost like a pap smear, if you will, for fibroids, where they are detecting these cells that these women have, and trying to have preventative measures before fibroids grow. That's still ongoing, still in the work. They found some very promising things with vitamin D and some other herbs and hormones, not hormones, but herbs and medicines that have shown some promise as it pertains to preventing fibroids. But there's nothing that's definitive. This is still ongoing work. And to that point, once they started, right? And then once they've gone and they like you have them, then they're there. There's not evidence. There's not a ton of evidence of showing of taking like some herb or supplement that's going to cause them to regress or cause them to eliminate. A lot of people make those claims, but we do not have factual statistical evidence of me taking, not me, but
Mhm.
someone taking a fibroid tea, an herb, a supplement, sea moss, elderberry, and it's now taking this 10 centimeter fibroid and shrinking it to a 3 centimeter fibroid. So that's the biggest problem that I have as far as when people are selling things or people are making claims on different things, like you have to have the evidence.
Mhm.
I am all about evidence, evidence-based medicine, evidence. If you have something that you can prove that you have two groups, group A, group B, one took whatever it is you're talking about, the other one took a placebo, and the person is giving it to them have no idea what they just gave them, and then you follow them out and you look at all of the factors, race, age, weight, demographics, all of those things, and then you can show a statistical difference from what you gave to this A group versus just a placebo, then you can successfully say this thing does what I'm saying it does. And that's a lot of the problems with when people talk about, you know, treatments and like, hey, take this and don't eat meat and don't do that.
This
Like
worked for
they'll argue
me.
with me.
Try this.
Yeah, absolutely. They'll argue with me all day long. It's because she ate dairy and she ate meat. I was like, so you basically all of the vegetarians and the vegans that I take care of, like they're lying,
Right.
right? You know, so, like you can't say that. Like, so it's like understanding what goes on and what happens. It's a lot of unknowns. As human beings,
Mhm.
we have to have an answer. We have to know what's going on. We have to have it right now. But some things are just not that way.
Mhm.
Just like a lot of the cancers and the things that we deal with, we just don't have all of the answers. But to that point, the information that we do have, we just have to utilize that to our benefit and do the best that we can.
Yes. Well, I also am a breast cancer survivor, and I was HRT triple positive. So when they started talking about HRT and estrogen,
Hmm.
and now now you can't have estrogen, now you can't have this, and I was a nurse, and I'm like, wait, what? What? So
Right.
now what y'all doing to me? What? Why are we doing
Right.
this? And
Right.
that's going into what my next question is for you, because I go on panels all the time
Hmm.
and talk as a wellness expert, and the first thing that they always ask about is disparities in black women, disparities in minority population. And I went off on a panel not too long ago and I said, "You guys don't think that it's a problem that we're here talking about a disparity still when we're talking about black women, when we're talking about maternal health, and you don't think that there's something wrong with still saying this is a disparity, this is affecting the communities? We're in Houston, Texas. Like, we're not in Houma, Louisiana, which is where I'm from. We're in Houston, Texas. Why are there disparities? You guys are focusing on the wrong thing here." And so they were like,
Right.
"Ooh, okay, light skin, you know."
Cool.
And I
Let's
was like, "Oh
light
God,"
skin
because
energy.
I'm sick of talking about disparities. Why is there a disparity? So I know you said it was your mission, sort of, not mission, but it's your passion to get those cases to talk about in the minority population, especially black
Right.
women's health. So what are you attributing to why is there a disparity in the treatment for fibroids, the growth of fibroids? What is your
Sure.
professional opinion about that disparity when you're talking about white class women compared to black women and their health?
Got you. This is an awesome question. And one that like people kind of get confused about my answer. But as someone that deals with fibroids every day that I'm on this earth, I'm talking to somebody or treating somebody or removing some fibroid, and that's what I do. Right. So having that experience, I come up with this conclusion. Uh, the misconception is that fibroids only impact black women. It's
Mhm.
false. I literally had a Hispanic lady, mid 30s, 100 pounds, and I pulled out 7.5 pounds of fibroids out of this Hispanic lady. Right? No, doesn't even speak good English, and is doesn't have any black roots. Right? She has advanced fibroid disease that I have to treat. So, I've treated white women, Asian women. Like I've treated the spectrum. So the thought that it only impacts black women is false. To this point, I will say that it does disproportionately impact black women worse than other people, than other races of women. And for that, I will attribute a couple of different things. Number one, for black women, there's a history. There's a history of stress. There's a history of poor um, uh, access to adequate health care, right? That's centuries. long or what have you. So when you do that, you can form genetic things that can carry on from generation to generation and generation. Fibroids being one of those things. So there's a higher genetic component, but also too there's a an element of stress that we don't talk about, right? Fibroids also are predicated off of stress uh, as well. And as a people, we have to deal with a higher amount of stress than more than anybody else in this country. In addition to that, the access to quality foods, right? So if you look at all of our our populations, our communities, we don't have access to whole foods, quality foods. There's a lot of processed foods that we ingest as a people, um, and a lot of things that we like, just from culturally, that are really not good for us too, that play a role in it. And then fourth, it's a social aspect of it. If you look at us culturally, we are now, because we're so behind from a cultural standpoint of wealth and success, we find ourselves as men and women uh, not only attaining success at later stages of life, we're also in debt at later stages of life, right? So we have, the stress of trying to make it, the stress of trying to pay back student loans, the stress of paying back bills, not having things given to us, not having things like just totally just being there for us. Well, other people, they were able to have their kids at 20 with no debt. They get fibroids at 25, 26, 27, take a hysterectomy, get a hysterectomy, be done with it while they're still small. Whereas a lot of black women now have been the burden bearers for their family, their communities, are looking up in their late 30s, early 40s, and now saying, "Hi, all of these things are now done. Now let me look into having kids." And by that time, fibroid growth has just gotten bigger and bigger and bigger and bigger and bigger, because the majority of the patients that I deal with are older, are great, in their later 30s, early 40s. So it's had time to manifest itself, whereas other communities, don't have to deal with that. They address that fibroid issue much earlier. So when you see that, you say, "Hey, why is it impacting us so badly?" But you're not looking at the demographics of the social abnormalities of what we have to deal with as it pertains to the disease process. So all of those things together
Hmm.
all contribute to why fibroids are more advanced in black women, why fibroids impact more black women. And it's not just more, it's 80% for black women, it's 70% for everybody else. It's just, in my experience, I experience more advanced fibroid growth, fibroids that are bigger than 10 centimeters, fibroids that are so numerous or so big that they're pushing the uterus above the belly button or the umbilicus. Those types of growths I experience more in black women than other women. Not so much that we just have more fibroids per se, it's just more advanced fibroid disease because of the things that I just talked about.
I like that. That's a good analysis. Thank you. So that leads me to my last question, and I wanted to get just a little bit, because I'm Dr. P. I'm not gonna make him talk for 2 hours, but my
We can do
last
it
question.
again. We can do
I'm
it
trying,
again.
I'm trying to do like a bullet point real quick.
Yeah,
What are some key things? Where you from? What you do? How you
yeah.
found it? What about this? What about that? Why is it disparity? And so my last question is, I also know that whenever I'm, especially when I do a lot of stuff here in Houston, and I'm in the community, and I work a lot of times, I'll do a lot of community service, but I'm at like these community events, so I'm around people, and they're more, on, we're talking about poverty level poor people who don't even have health care. And so I do know that I hear a lot of talking about people who maybe don't want treatment because they don't want to lose their uterus, or a
Right.
lot of people might feel that something is wrong and they're scared to go to the doctor. I'm in the middle of a prostate cancer thing right now, and all we're doing is talking about education for black men going to get checked, and nobody wants to go get a digital exam, nobody wants to do that, everyone is like and we're trying to say, hey, but if you don't know, if you don't get it checked, It's actually worse. You can't
Okay.
continue to prolong it. But I do know a lot of women, especially like you said, when we're talking about Black women, minority women, even Hispanic women, I got to go to work. I got stuff to do. I don't have time to take care of myself. Oh, I got a pain, or oh, I don't feel good, or oh, my periods aren't regular, but I don't have time to go to the doctor. If I go to the doctor, then I have to have surgery. Or even if they're diagnosed, I don't have time to recover from a surgery. I can't take time off. So a lot of times they prolong that treatment. So I know you said you do minimally invasive and you do remove the fibroids, but can you tell us what the treatment is for anyone that maybe has been diagnosed with fibroids, maybe thinks they have fibroids, wants to know if they have fibroids? Can you give us some education on what is the general treatment to kind of take away that negative stigma, like, hey, it's not that bad, or these are some of the options that you can have?
Well, you asked some great questions. They be loaded though. They are all. It's a lot to them.
I gotta do the bullet, Dr.
You're
P.
right.
I'm
You're
like,
right.
bam,
It's my
bam,
fault.
bam, bam. Okay.
I'm late, so it's my fault. But yeah, these are phenomenal questions. I just want to answer them completely. Um, the notion that, well, first and foremost, the fear of doctors from us as a people is not only um, factual. It is real. It is something that it comes from a real place of just centuries of abuse, mistrust. So every woman, their grandmothers, aunties, cousins, they've been through things from a surgical standpoint that causes apprehension and causes fear, and those stories are real stories, and they get perpetuated down to us. So it'll get passed down to us, and it's like you can't say that those things are not real. The Black woman's appendectomy, which was a hysterectomy in the 60s, 70s, is real, right? Women were getting sterilized, getting their uterus removed, not only just getting them removed, but getting cut from hip to hip, getting cut from their privates to their chest, like to get their uterus removed. That happened, and it still happens today. So to that end, the fear is real, the fear is healthy, and I respect and I'm empathetic about the fear of doctors, especially by Black women, with everything that Black women have went through in this country. To that point, you really have to the take your care into your own hands. You have to be very strategic and be very, very smart about who you allow to in your space, who you allow to take care of you. And I tell patients all the time, listen, we have a lot of information right now. We have a lot of information. Social media is a crazy thing, but it's also a very beneficial thing. 30, 40, 50 years ago, we could not just go and look and see what someone's life was about, what their private life was about, what they've done over the past 10, 15 years. That wasn't readily available. People were able to operate in silos and do these things to women in silos without no one ever knowing about it. They can't do that anymore. Right now, you have to really take it as a personal mission, crusade, if you will, to now look into every single person that's taking care of you, and make sure who they say they are, and make sure that you're comfortable with the care that they're giving you. And we don't do that enough. We kind of rely on other people, or look at Google reviews or what have you, as opposed to really doing the research and going in and seeing, like, hey, what is the social media about? Like, you talk about your, just this guru or whatever you are, and you don't talk about none of that. And you don't, like, I saw you at the Trump rally. Like, let's talk about that. Like, let's look at these things as you go into, have someone care for you, that literally, once you go to sleep, you're in surgery, this person is responsible for your life, your life, your family's life, everything. They having a bad day, they have a mistake or what have you, it has changed the trajectory of your life and your family's life forever. So before you give that person that power, you need to make sure that that person is the person for you. But it's in specifics for fibroids, right? Fibroids, again, can exist with no problems, and you can live with them. So I would not be OCD and neurotic about, do I have fibroids? Do I have fibroids? Because it's weaponized, and it's come to a point where it's like, oh, you got it. So now it makes everyone crazy.
Mhm.
Don't go looking for them unless there's something there that's showing you that I need to do more investigation. Listen to your body. abnormal uterine bleeding, your periods are really, really heavy, they're lasting long, they're very painful, you're having pain with sex, you're having infertility, having very frequent urination, your belly's starting to protrude and you don't know why it's protruding. And it's not just because of what you're eating and you're doing healthy diets and those things. It's actually you feel hard lumps in your belly. Those are the times where you have to now look into it and get an ultrasound, get an MRI to actually see if those fibroids are there. So you go looking for them when they give you signs and symptoms that they're there. If they're not giving you signs and symptoms, you have normal periods. They last 4 days, and you change a couple of pads during those days. You're not having a lot of cramping. Your day-to-day life is perfectly fine. Everything's good. Don't go to your doctor saying, "Hey, I need ultrasound to see if I don't," because if they find a 2 centimeter fibroid, then what? Find a 3 centimeter fibroid, then what? It doesn't, like, now what are we talking about? Now do we have to have surgery? Now we don't have to do those things unless it presents to you, and then you go start to look for them. So that's what I say. And as far as how you treat, how you prevent, how you do things, healthy lifestyle, healthy living, right? I changed my life like 6 months ago. I haven't eaten red meat since that time. Like I've adopted, you know, I'm not all the way vegan, but you know, as much I don't eat any meat, but you know, dairy, I've completely tried to reduce all of that. You know, I still eat some fish every now and then, but for the most part, I'm a plant-based, healthy diet, and I feel my body is reflected. Like I feel that in my system. And to that end, to that point, we have to really take into account everything we put in our mouth, how we live our life. Are we exercising, drinking a lot of water? What you put into your body is what your body gives. And to that, you know, when people say, "Hey, I took this and I feel better," yes, even with fibroids, if you have a healthier lifestyle, your symptoms are going to be better. It doesn't necessarily mean your fibroids have shrunk or they're going away or what have you, but it can help your periods if you eat healthier. It can help your pain. It can help your overall health. It should help your overall health. So eat and live your life for overall vitality and health. As it pertains to fibroids or any other, condition or issue. That's my tidbit for everybody.
That's good advice. One, I'm jealous. I can't tell you how many people I've had on my show that are vegan, whole food lifestyle. And I'm always like, yeah, yeah, they got, and I'm like, you know what? I'm gonna do that. I'm like, I had a lady on, she gave me all the deets of how to do whole food, how to
Yeah.
transition. I was like, okay.
Yeah.
Then 3 days later, I'm drinking my Celsius.
Yeah. Really,
I'm going to,
you know what you do? What changed me? This, and I'm not giving it a pub, whatever. On Netflix, You Are What You Eat.
I know, I
I
saw,
you saw it? Change.
and I'm like you, Dr. P. I see people all the time. I talk to people all the time. I am always somewhere with healthy people, but I do eat. I got
You look good. You looking good.
okay,
Looking good.
like I ain't, yeah, like I ain't obese or
Yeah.
nothing, but I do eat a crumble cookie every
Yeah.
now and
I
then.
mean, again, so it's in moderation, right? You know, it's always extremes for everything. We kind of hold ourselves like, "Oh my God, you have to, you
Mm.
can't eat this, whatever." Like, just in moderation. I'm not saying you can't eat meat, but just in moderation. Like,
I know, and I usually I'm like I always say I'm gonna have chickens. I'm gonna have feathers grow out of me. I eat so much
yeah.
chicken. I like
And I love.
I'm gonna start
I
clucking.
had chicken in 6 months. I love it, but I just.
I'm proud of you. I'm trying. I tried to do the shrimp. I tried to do anyway. We're gonna talk
We'll
about it
talk
later.
about it.
But okay, so I know you are in
Yeah.
Chicago, correct? But how can people follow you, like you, subscribe, all of that stuff? Because you guys, Dr. P puts out tons and tons of information, obviously, because he showed up on my Explorer page and I saw one of the videos and I said, oh my gosh, this is so great. I just need to excise some of that stuff that he says and pass it on to my audience
Awesome.
because it's such great information. But I do think that because you have a podcast also, right? You have
I did. I
uh
kind of fell off my podcast wagon. I'm gonna pick
oh,
it up, but
well, you still got old videos.
yeah,
You got stuff. You've been doing other
I got
stuff
content for days.
besides fibroid
Yeah, I
slaying.
got a content for days. Now I'm just doing a lot of surgeries, but to get to me, IG, TikTok, spell out Dr. DLCTORP23 on TikTok and IG. Facebook, it's Pierre Johnson MD, and for websites, consultations, all of that is www.fibroidslayer.com. So anybody's like, hey, I want to get to talk to him, consultations, that's what I do, and to that point, I probably have about a good, I would say, 8 to 10 patients that have flown from Houston. Houston is one of my hot spots for, like, where they just don't have a lot of options when it comes to advanced fibroid disease. Women fly into me all over the country, not only in the country but out of the country. I literally have a patient from Norway that's coming next month. I've had Finland, Canada, like, so it's when you have advanced fibroid disease, there are just not a lot of options. Not a lot of options to preserve your uterus. There's not a lot of options to do it in a way that's going to preserve your cosmetic appearance and preserve your ability to recover and get back to work. So when it comes to that, I'm that guy. So I'm so excited and just thankful to God for giving me the opportunity